Hello, Center for Effective Living community. It's Valerie Ling. I am the privileged director and founder of the Center for Effective Living. I've been thinking about you. I have been thinking about the community of the Center for Effective Living who have been coming into the practice and thinking about all the different ways that COVID-19 must be impacting you. I've been thinking that for those of us who suffer from health anxiety, obsessive compulsive disorder, depression, and the range of mental health issues that we see in the practice, something like COVID-19 can be very, very distressing for you. And I wanted to share with you that we totally understand and we totally get it. What I want to say is a couple of things. First of all, to speak directly to those of us who are impacted by an escalated distress because of COVID-19. And then secondly, to those of us who are observing this distress in those that we care for. So first of all, to you. You have probably come through many more things than you give yourself credit for. And the same things that have helped you sail through those difficult periods is going to help you this time. So now would not be the time to avoid or decrease the therapeutic support that you have. Now would be the time to hold hands with us and link arms with us as we support one another through this difficult period. Where possible, if it's not necessary, reduce your exposure to the news and the social media coverage. Not a lot is going to change in a matter of hours or days. And really being bombarded with images and messages and replays just heightens the cognitive processing of likelihood that there is danger, right? So as human beings, we tend to have cognitive biases that do not help us when we are anxious. And the more we get exposed to social media and news coverage of COVID-19, the more that's just going to feed that machine. You don't need that. Walk away. Put instead in front of you a book, put in front of you a piece of doodling or coloring or cooking or gardening. Go and enjoy the world that is perfectly within your control instead. Next, where you can know the facts and be at rest with that. There is no need for us to continue to rehearse those facts and looking for minute changes in statistics. Do what you do best. You know how to keep yourself safe. You know how to keep yourself clean. You know how to keep yourself within sensible healthcare hygiene. Continue with what you know. Third, don't withdraw. Many will be tempted now to withdraw from from contact with people. How we do that, there's wisdom in that. Now is not the time to not meet people who care for you, not meet with the people who provide you with support. Now would be the time to actually reach out, whether it's by telephone, by message, by meeting up if it's okay to do so. Now would be the time to stay connected. Remember that in a situation where you are watching other people go through mass hysteria and panic, the temptation is that is the normal, and we will want to be pushed to think that if we don't behave like that, then we might actually be somehow missing out on an important way to survive during this time. But remember this also, in heightened levels of panic, our window of tolerance actually reduces, and we're actually not able to be the space of calm and sensibility that we need to be able to respond. And it pushes us more and more to be offline and more for our anxiety to just take over. So you don't need that. For children, It can be particularly distressing during this time, particularly the ones who are in primary school, where they may not know how to tell fact from fiction. They may very easily hear things and misinterpret what they're hearing. And so having conversations that just normalizes what we do and provides corrective information on the go, help and a space to talk about this will help to actually give children a sense that, oh, all right, it's safe. There are a bunch of things that they can do, and the rest they can let it go. Now, for those of us who are caring for people and we're watching our loved ones go through distress, now is not the time to joke about that or to minimize that or to put it into the category of being irrational. For those of us who suffer from anxiety, this is probably our worst nightmare come true. Their psychologists or their therapists would have spent a lot of time saying to them, what's the likelihood that this would happen? What's the likelihood that bad things are going to happen? And working with those of us who have anxiety to actually do things like keep hand washing and a fear of germs to a normative position. But what happens when the new normal gets heightened to increase of hand washing and hygiene and face masks and things like that? Then it's our worst nightmare come true, that whatever it is that we thought was keeping us safe and normal has now been ripped away. So now is the time to really link into compassionate dialogue, into agreements of increasing self-care and support and being around for one another, and having conversations that can be about the good spaces and the healthy spaces in your world, in your home. Keeping the focus really on, yes, there is COVID-19. There are also these things in our world, all the things that are going right. This will be a great time to actually celebrate wins and to connect with one another just on the positive things. What can we be grateful for today? What can we share with that gave us a sense of joy and delight? Now would be a great time to shift the conversation to those spaces as well. I hope that you stay well and you keep well. Take care.